Hello, hello, everybody. Welcome in, welcome in. Sky Houston here with Magic 102.1. Excited to have this conversation today. We have had an unprecedented 2020 on into 2021. It has now been announced details of the vaccine, the COVID-19 vaccine, and super happy that Radio One has partnered with Mayor Sylvester Turner and the city of Houston to bring you the facts, to share what can happen, what will happen, and what you can look forward to as details of the vaccine rolls out. So on today, I'd love to welcome you if you're on Facebook Live, if you're tuning in on YouTube Live, wherever you are, share this broadcast so that your friends, your family, your network can get the real deal information, not the hearsay, but true facts from doctors who are board certified and who have joined us today for this wonderful roundtable discussion. So without further ado, I'd like to bring in our panelists for today. I'll start with Dr. Purse, the Chief Medical Officer at the City of Houston. Dr. Purse, are you there?
I am. Thank you for having me. Thank you, everyone at Magic 102.
Dr. Purse comes in again. Share this broadcast if you would, so that more people, more of our listeners, more of our family and friends. There he is. Hello, Dr. Purse.
Hello. Hey, thanks for having me.
Wonderful to have you on today. Also on the panel for today, I'd love to welcome in Dr. Higgins. Dr. Higgins, are you there?
Yes, hello, Dr. Higgins here. Happy to be here today. I so appreciate the ability to be invited, and I hope we share some really good information.
No doubt. Dr. Higgins specializes in mental health disorders, so we look forward to what you will share with us today. Thank you. Also, Dr. Blunt. Dr. Blunt, are you with us?
I am here, and again, thanks to everyone for this opportunity to share with the community.
Please share this broadcast. If you're watching, share it so more of your network, your family and friends can hear the information that we're going to bring to you today. There he is. Welcome, Dr. Blunt. Welcome.
Hey, thanks again for this opportunity to share with the community information about the COVID-19 vaccine.
Wonderful. And Dr. Higgins specializes in preventive medicine and health maintenance. Excuse me, Dr. Blunt. So we look forward to hearing from him today. Again, share this broadcast and feel free, if you're watching while the discussion goes on, be a part of the discussion. If you have questions for any of our panelists today, you can put them in the chat below, and we will see the comments as we go along. So without further ado, again, Sky Houston here with you with Magic 102. We're joined for this roundtable discussion on the COVID-19 vaccine. And let's just start with the basics. Dr. Purse, if you would, tell us about the vaccine. What is it and how does it work?
So thanks. It's a great question. There's been a lot of misinformation about it. So the vaccine has taken a little tiny bit of the RNA from the virus, the little tiny bit that codes the cell to create the spike protein we've heard so much about. And so when you get the vaccine, all it is giving your cells the instruction to make that spike protein. You start making the spike protein, your immune system says, what is that? That's not me. That's not supposed to be here. It learns about it so that if it ever sees it again, it immediately attacks it and gets rid of it. So that's basically what it is.
Okay. And how many different vaccines are there currently? I hear, oh, this vaccine works, this one doesn't. How many vaccines are there?
So currently in the United States, there are two vaccines, the Pfizer and the Moderna vaccine, that have been authorized. But we can expect many more, or at least several more, let me put it that way, over the coming months. Originally, there were about 150 different vaccines that were put into investigation and development. Around the globe, there's down to about maybe 10 or 12. And I'm expecting by the end of summer, we may be dealing with another 3 or 4, maybe even 5 by the end of summer. But right now in the United States, there's only 2.
Okay, 2 vaccines currently. All right. And I want to go ahead and throw this and put this on the table. We have seen that the communities of color, mostly the African American community and the Hispanic community, were hit the hardest when COVID first came. And I'm going to throw this one to Dr. Blunt. Who can get this vaccine? Is it for one demographic over the other? If you can share with us, who can get this vaccine? Who is this vaccine for? And what are the different phases for the vaccine?
That's a great question, Sky. And this vaccine is available basically at this point to, well, let's talk about the age range first. Okay, and as it relates to the vaccines, the Pfizer vaccine is approved for patients and people age 16 and older. And the Moderna vaccine is approved for patients age 18 and older. And so when we think about just the age groups, those are the age groups that are participants or who are could participate as it relates to getting a vaccine. But then we think about the phasing of the vaccine in terms of groups of people who are eligible for the vaccine. Well, the phase 1A, those are the patients or the people who are frontline healthcare workers, or those patients or people who are frontline first responders. Also, people who work in healthcare facilities or who work in nursing home type facilities. So those would be the nursing home patients as well as the healthcare workers who work in those environments. But in addition to that, anyone over the age of 65 is eligible to get a vaccine at this point. And if you're over the age of 16 and you have a chronic health condition such as heart disease, or if you have kidney disease, or if you have cancer, you also will be eligible to get a vaccine at this point. So there's a wide variety of people and patients who are eligible to get a vaccine at this point. And if you fall into one of those categories, you are eligible right now to obtain a vaccine.
Wonderful. And I know I lumped that all together. That was a loaded question. But if you would really quickly, I love the differentiation between brands. Would you say those two different brands again and the age with the brands? Just so we're clear.
Okay, both vaccines are messenger RNA vaccines. And so one vaccine, the name of one vaccine is Pfizer, and that is indicated for patients 16 and older. And then the second vaccine is Moderna, and that is indicated for patients 18 and older. Both vaccines require 2 injections. The Pfizer vaccine is 21 days apart between 21 days of duration between the first vaccine and the second shot, the second vaccine. The Moderna vaccine, there's a 28-day difference duration between the first vaccine, the first shot, and the second shot. So there are 2 vaccines that are available. They both are equal in terms of effectiveness as well as safety. So there's not a lot of difference between the 2 vaccines.
Okay, good to know. And I'm making my own personal notes. I know I'm on here hosting, but I'm just as concerned about getting the vaccine and giving it to my little one. I have an 8-year-old, and I love the age breakdown. So for those households who have like multi-generational, multiple ages in the house, what's the youngest that can get it? I know you talked about the 16 and older, 18 and older. What's the youngest? Is 16 the youngest age for the vaccine?
But for the Pfizer vaccine is age 16, and for the Moderna is age 18. But in both of those categories and situations, the person must also have a concomitant medical illness such as heart disease or cancer. Diabetes would be another qualifying disease for a patient in that age range.
Okay. And after you get the first dosage, I've been hearing that a lot of people aren't going back for that second dosage. Have you been seeing that? And how important is it to come back for that second part of it?
It's very important because we hear about the 95% efficacy associated with these vaccines, but that particular level of effectiveness does not occur until you get the second vaccine. So after the first vaccine, the efficacy does not approach the 90 percentile. So you must get the second vaccine to obtain the full effectiveness of the vaccine, which occurs generally about 7 to 14 days after the second shot.
Okay. Wonderful. Okay. So I'm going to reinforce that, guys. If you've already gotten a portion of it, please go back and get the second half if you've chosen to. And I'm going to put this one out there for anyone on the panel to address. For those people who say, I do not believe in vaccines, they don't work, or they're not for African American people, or it's a conspiracy theory. If any one of you want to pick that up and just address that type of concern for our viewers to
I
to
guess
get
I'll
it or
take
not to
that.
get it or believe in that?
I'll take that one. And the fact is that we have to acknowledge the issues and the history of Blacks in America, and when it comes to experimentation, and the fears that we have, realizing that those fears are real. And I don't blame individuals for acknowledging the historical fact of some of the problems that we've had in this country in the history, and even currently right now with disparities in care. But the fact is this: vaccines work. So realize that 99.9% of all people are the same. All right. When it comes to the issue of genetics, the disparities are those who receive care versus not. This vaccine does show to work for all people, all races. So you don't want to be one of the people who get caught in the past and not receive the help that you can, because the issues that we had before, and when you look at the historical issue of vaccinations, be it typhoid, be it even the Spanish flu, many people in the Black community were the last to get the vaccines. But now that we have Blacks in medicine in these positions, you have a Black mayor, you have Black doctors who are accessible in your community who are receiving these vaccines. You have access now. So you don't want to let the historical past cause to put you and your family in danger and sadly cause you to die. All right. And so we also have to combat misinformation that goes in the Black community, because when the virus came out, there was a lot of misinformation that Black people couldn't get the virus. And then I heard people talking about radio waves and 5G towers causing people not to be able to breathe in the hood. All this bad information, we have to make sure that we push against this. And the job that you're doing today, Sky, helps to combat against that. And so we want to make sure that people get vaccinated, understanding that if you get vaccinated in your home, but the person next to you in your home does not get vaccinated, realizing that the vaccine is about 95% effective. But if you're around that person 100% of the time, they're continually challenging your body to fight off the virus, there's a chance that the vaccine will fail. That's why you need people in the community in number to get vaccinated, because one person being vaccinated is not going to be enough. We want to get back to our normalcy. And one thing I'll say, and I was driving down the street, and I won't say where I was, but I was in a Black area with a lot of clubs and bars, and the place was packed. And I saw people dressed up, looking good as I was passing through on the street in my car. Well, one, I wanted to turn my air conditioner off because I don't want to breathe anything going on this street. But two, while people are thinking they're having a good time, I'm seeing death. I can guarantee you that as I look into this bar and that bar, there will be a few people in that room who are going to die because they're not wearing masks. Because when you're in a bar, you're drinking, you're eating, you're yelling because the music is loud, and people are spreading the virus rapidly. It's a super spreader event. And then many of them are going to take it home to other individuals. The fact is that not enough of us have had this vaccine long enough to be protected as of yet to 95%. So we're still in the emergent portion of this virus, and we want to make sure that we don't get COVID fatigue and believe that we're okay now because there's a vaccine. Well, no, you're not okay now. And if I get the vaccine, but no one else around me has the vaccine, I'm still not safe.
I would like to add to that, Sky, if I could,
Absolutely.
Yeah, vaccinations have played a major role in public health throughout, the history of America. And there are a lot of illnesses and diseases that are basically non-existent, at least in America, because of the role that vaccinations have played. And many of us, even growing up, received vaccinations for school. And so we are real familiar, should be, with the history of how vaccinations have played a major role in terms of keeping us healthy. And so I think if we just think about it from a historical perspective view, in addition to what Dr. Higgins has just spoken of, that it would be important to consider to take this particular vaccine just based on historically, vaccines work, and vaccines help us to have a healthy life, help us to have a healthy community, and would help us to have a healthy nation.
If I could join in, I'd like to echo everything that Drs. Higgins and Blount said, and they said it better than I could have. They're exactly right. And the other example I'd like to give is that, we don't have smallpox on the planet anymore, other than in research labs. We've been able to, through vaccine, be able to eliminate anyone's risk of getting smallpox. And you know what? Here in the United States, we had effectively gotten rid of measles. The only measles cases we had in the United States was when it was imported, when somebody had traveled somewhere and brought it back. And that's changing now. And it's changing because around the globe, people are developing this unjustified fear of vaccines. And it's allowing, right now it's allowing measles to have a resurgence around the globe. And I'm old enough that I remember I actually had two forms of measles. I had measles and German measles. And my parents and my grandparents were really upset about that. I was a little kid. I was going to be fine. But they knew that the pregnant mom down the street was at risk because of the measles that I got. So we lived in a time when you got to see firsthand the impact of vaccine preventable illnesses. And I went to school with a kid who had polio, and his legs were in crutches or in braces, and he used crutches, and he had terrible vision with big, thick glasses from polio. Well, you don't see polio anymore. Not commonly, it still exists, but it's so we live in a time when we are so fortunate that we don't see a lot of these vaccine preventable illnesses firsthand, that unfortunately we've been led down this road of believing that you don't need vaccines and all this other malarkey that goes with it. And I just want to thank my colleagues on the show here for everything that they had to say, because they're exactly right.
Absolutely. We're happy. Again, Radio One is partnered with the city of Houston to have this roundtable discussion today. Again, if you're just chiming in or viewing in, share this broadcast so that your friends, your family, anyone within your network can get this information firsthand, not hearsay, but from board certified individuals who can speak to it. Really quickly, I want to go to the comments. I see a lot of our Facebook Live viewers have questions. Memory Tyson is asking, I'm 52 with heart and kidney disease. Am I a candidate for the vaccine?
The answer is yes. Because she has that concomitant medical illness of the heart disease, and she's over the age of 16 for sure, she would be a good candidate. She is at high risk for complications if she does obtain the COVID vaccine infection. So yes, she is a great candidate for the vaccine.
Good. The next question is, people are concerned about scams, vaccine scams that are out there. Are there safe links? Roxanne Morrison is asking this question. Are there safe links to get a list of the vaccines that are true vaccines and okay for everyone?
So I'll jump on that. And there are some scams out there. Let me just point out one thing. One easy way to tell whether or not somebody's trying to victimize you with a scam. If they are asking you for any money at all, you need to turn and walk the other way. The vaccine is already paid for by the federal government. The places that are giving the vaccine, whether it be a doctor's office or a clinic or the hospital, they can charge either the federal government or they can charge your insurance company if if you're insured a small amount of money. But that doesn't go through you. You should not have to pay a penny. If somebody's asking you for money, it is a scam or they're breaking the law, one of the two. So that's probably the easiest way to know you're being victimized by a scammer.
Good. Now, again, today's discussion is to, get rid of the myths, get rid of the hearsay. Ann Powell saying that she was sad to hear that the Harris Health System had canceled vaccination appointments because of limited supply. Is that a true thing that really happened? And is there a new supply coming?
So I'll jump on that one too, and that is true. And this has to do with a little bit of unpredictability of the vaccine supply. And I always want to point out that so far I've not found any bad actor. There's nobody who's acting in bad faith. It's just that we don't have clear vision as to how much vaccine is going to come and exactly when. And I will tell you from the city standpoint, we've not only not known how much vaccine was going to come, but we've been told, okay, you can expect this much vaccine on this day. Sometimes it's come 3-4 days early and we've been pleasantly surprised. And other times it's come right on schedule and maybe there's been more than what we expected. But they're still working out the kinks at the federal and the state level. And the other thing was that over the past couple of weeks, a lot of providers who got vaccine in previous weeks didn't get any at all. And so this is the situation that Harris Health finds itself in, is they haven't gotten any vaccine for a couple of weeks. And the state assures us that that will get rectified and that will improve over the coming weeks and months. But today it is iffy as to who's getting vaccine and when it's going to arrive.
Now, based on where you live, does that prevent you from going anywhere else? If you live a certain county in Harris County, or if you live elsewhere? Are you able to go anywhere to get the vaccine?
Yeah, well, the vaccine is paid for by the federal government. So if you live anywhere in America, you're eligible to get the vaccine. Now, the governor the other day said that the vaccine that comes to Texas, he intends it to be used on Texans. But really, we've not gotten any specific guidance from the federal government about that, other than it's supposed to be used on Americans or people who reside in
Harry's
the
asking, do you have to go to a doctor? Do you have to have a doctor to get the vaccine?
The answer is no, because the way the system is set up with the hubs, that you don't have to have, say, a doctor to get the vaccine, but you must more often than not register to obtain the vaccine. So as you go through these websites, and the city of Houston has a website that talks about where vaccines can be located, that once you go to that site and you see the location that you would like to obtain the vaccine, then there is a type of appointment or reservation or registration type of process that one must go through. But as far as actually having a doctor, then for the most part, you don't need to have, say, a doctor to get a vaccine.
Thank you, Dr. Blunt. I know Dr. Purse addressed it, but I wanted to ask it specifically as the viewer was wording it to make sure they understood and proper speak. Again, guys, if you want more information, you can always go to the HoustonEmergency.org/COVID-19 website for those details. Really quickly, how would you say, well, the question being asked, is there any way to expedite getting the vaccine? Can you expedite yourself getting it? I believe earlier we discussed the phases. If you guys would reiterate for those who are just getting on, what are the phases? Who can get it when?
Yeah, the two phases basically. There's phase 1A, and those are the people who are healthcare workers, frontline healthcare workers. So those may be the folk who work in hospitals, as an example, the ER docs, or maybe the nursing staff, as an example. And then you also, in that group, you have the people who live in nursing home facilities, or people who work in those nursing home facilities, as well as first line responders. So that would be, for example, maybe the emergency medical technicians, as an example. And then in addition to that, you have the next level of people who are qualified to get a vaccine. Those would be the people, two subgroups. A, the people who are over the age of 65. So if you're 65 or older, and regardless of what your health status may be, if you're over the age of 65, then you qualify for a vaccine. Or if you're over the age of 16, but you have a concomitant medical illness such as diabetes, or if you have heart disease, or if you have kidney disease, or if you have lung disease, or even obesity, if your BMI is greater than 30, that would also qualify you too. So if you're over the age of 16 with a concomitant medical illness, then you also will qualify for a vaccine at this point.
Okay. Now let me ask this question. We've talked about who can get the vaccine. We've talked about where you can get the vaccine. I'd like to know personally, what happens when you do get the vaccine? What are some of the symptoms? What am I in for? I have not gotten it yet. I'm debating to get it. Let me know what to prepare for when I get that first shot. What are the symptoms afterwards?
Well, go ahead. I'm sorry.
Well, I'll just say my experience, which was, pretty, I would say it was the arm soreness. A lot of people said arm soreness, and I expected it to be like the flu, and like the flu shot that I normally get. And I found that it was more sore than the flu, and I had a little loss of range of motion. I did have a little bit of the chills type symptoms and body aches. That lasted for about the first day or two, and then oddly enough, on the second day, I could feel it relieving, and then like by that evening, I felt better than I had felt for the last day and a half. Now finally my body woke up and was ready to go. And then I woke up the next morning and no symptoms at all. All right. So I would say I did feel like a little ill, but it was an odd ill. It was like kind of like the flu, but not as bad. You felt tired, but not like you needed to get in bed. I was able to complete my day, and I work a lot. I work hard, and I was back at it. So, mostly people have seen the arm soreness. I did have a little bit loss of range of motion a bit for about maybe a day there. A little bit of. I never got fever. Some people have felt a little fever. Some people felt a little chills. I just felt a little achy all over. But day and a half, and everything was fine. So I hear that the second dose tends to have more of that effect than the first dose. I had a friend of mine who just got it yesterday, and we had a phone call where we're working on something. And she was like, y'all, listen, I'm just a little bit tired today. She texted this morning saying she felt better, and she was back at it. So that was after about another 2 or 3 days. So realizing that the vaccine, what it's doing is introducing a little bit of the virus to you to get your body ready and prepped. And one historical thing I'll say about vaccines are more than 100 years old. Using vaccines for people and herds and cattle and all that, pricking the body just a little bit, pricking somebody who is ill, and then pricking somebody who is not ill, or pricking a cow that is ill, and then pricking one that is just to give it mild symptoms so that it can mount a defensive response to the virus. And one thing I'll say about, we have to understand when it comes to whether we're going to take the virus or not, I like how I heard it once where they said a virus is like a viral video. All right, a viral video. I enjoyed the video, so therefore I shared the video. And next time I share it, I edit it, I change it a little bit, and then you share it and you share it and you share it. So a virus is trying to get into your body. All right. In order for it to stay alive, it needs to go into another person's body. But in order to keep it visible and to keep it, say, like a viral video, entertaining, or to keep the illness going and for it to live, it switches and changes a little bit to keep spreading. And so now we have a virus that is being viral within people, and it's killing individuals as it's trying to switch and change and get into the next person. That's why we need to get the the vaccine so that our bodies can respond and stop the virus right now so that it's no longer being shared. And until we do that, it's going to cause a lot of people to die. That's why it's going to be important that despite the particular side effects that we may have, it's going to be extremely important that we stop it here so that we don't kill our spouses or our children and they take it to school and spread it amongst others. We got to stop the viral portion at this point right now.
I would like to add on that. I would like to add on to what Dr. Higgins has said is that generally those are the kind of the potential adverse effects of the vaccine, the fever, the body ache, the muscle ache, the arm soreness, the fatigue. Those are generally some of the common adverse effects associated with the vaccine. But I would like to suggest us looking at it in a little different way, that when we have those adverse effects, that's a good sign, because that means that the body is responding to the vaccine, that your immune system is responding to the protein that the body has produced as a result of the vaccine. So let's look at it the other way, that actually the adverse effect or the symptom that you may have, if you can endure that for those couple of days, whatever it may be, that actually is a good sign that the vaccine is, if I can use this term, working, and that you are on your way to getting the protection that you need with the vaccine.
Thank you, Dr. Blunt. And I'm going to double down on that to say, on the back of you, Dr. Blunt and Dr. Higgins, do it. If you made the decision to get the vaccine, endure the vaccine so that you can save not just yourself, but those in your household, those whom you love, who could be exposed if you did not endure. So and I'm going to send that to a few of our viewers. Claudette Berry is saying, what? We have to introduce this virus into our bodies, meaning you're putting the virus in my body. Yes, that is what they're saying.
Well, if I can clarify that. So the Moderna vaccine, for example, only uses 2% of the viral RNA. It just takes a little piece of the virus's RNA, which then causes your cells to start making that spike protein. Mm-hmm. And that's what your immune system learns to reject. So it's not the entire virus. It's just a tiny, tiny little bit of it. So I don't want your viewers to think you're actually getting the vaccine, the entire virus, just a tiny little piece of it.
They're just introducing it so your body can make an immune response. But what I would say is this: death from the vaccine, 0. Death from coronavirus is 1 in 64. Not to mention 2/3 of people who are getting the coronavirus are having residual symptoms that are still going on right now. So I have a friend, he got the virus in October, and he still cannot do mild to moderate exercise because he now has cardiomyopathy, which is a deadly illness that can kill you later on. So the thought is, okay, I have a little arm soreness. I'm feeling a little down, a little tired. I had to go to bed early, for a couple of nights, and I slept 9 hours, and I woke up and I was fine. Versus I got the virus from a friend who was not, who sadly got it, be it protecting themselves or not, and now I got it, and now I'm damaged for what seems to be chronically, or may even for the rest of my life. All right, so you're looking at a short-term issue. And many people, I've had friends who got the shot who had zero of that, no arm pain, no fever, no chills, and they got a shot. Like, and what shot? So the fact is that, oddly enough, the shot really doesn't hurt. I've had worse shots. The shot itself didn't hurt, but that's your body responding to it so that it can be ready to play. It's like you don't want to try to play a game and you haven't practiced. So what you're doing is giving your body a little bit of preparation to fight it off. And we want to make sure that we do that, because 1 in 64 dead, waiting to die. I got the virus, I'm feeling ill. Will I be dead in 5 days? That is what people mentally go through when they get ill with COVID. Am I going to die? People are writing their wills out, not knowing if they're going to live or die. You don't want to mentally have to face that, because what we're also not talking about is the mental health pandemic that is going on from the trauma of having the virus, the trauma of losing family members, and fearing and waiting. And I'll say it like this, and I may be stepping a little bit far off here, but either you're waiting to get the vaccine or you're waiting to get the virus. You're passing by people every day who have the virus. I can guarantee you, at the grocery store, if you went to the bars that I saw, or just even in your workplace, or even in your family member, you're walking by the virus all the time. You're just waiting. All right. So make sure that we stay clear into understanding that this is a deadly illness that is going on. Pandemics happen once every 100 years. And from a Black folk who like to read the Bible, most of us go to church, pandemics are in the Bible, and it talks about how to respond. Where do you think we get the mask from? And when you go to church and communion, they have the white sheet over the communion table with the white gloves, showing with the white scarves over your head, or who's clean and who is not. That is all control of illness. So these are not new things. So we don't want to look brand new and not know our history. Viruses occur, and they're living organisms that have always been here, and we know how to fight them. Let's not play slow and not learn from the historical record of how to get through this.
And in addition to that,
I love how you just got in. Wonderful.
And in addition to that, too, to what Dr. Higgins and Dr. Peirce have said, another good way of thinking about it is that as from a mental health perspective, we're tired of COVID fatigue, mass fatigue, depression, anxiety, all those things I'm sure Dr. Higgins is seeing a lot of. Every time we get a vaccine, a shot, we're one step closer to getting out of this pandemic. So every time, if I got the vaccine also, and so I tell all of my patients that each time you get an injection or get the vaccine, we're one step closer. So one by one, person by person, we can get out of this thing if we decide, that man in the mirror decides to take it upon him or herself to get that vaccine, that as we do that, we get one step closer to getting out of this pandemic.
If I could add on a couple of little fun facts that I think puts in perspective, and this goes back to something Dr. Higgins was saying. And just today, the CDC released new information about how many anaphylactic, the severe allergic reactions people are getting with the Moderna vaccine. And last week they released it with the Pfizer vaccine. And long story short, with the Pfizer vaccine, it was about 1 in 100,000 people who got the Pfizer vaccine had a severe anaphylactic reaction, allergic reaction. With the Moderna vaccine, it's about 1 in 400,000. So it's even less, quite a bit less. And so people are sort of saying to themselves, they're saying, well, gee, I don't know if I want to get the vaccine. I hear all these, bad things about vaccine, and I don't really want to have a sore arm for a day or two. And they're weighing that question. And then, so first of all, your chances of having a severe allergic reaction are literally at least 1 in 100,000, which is really, really tiny, right? A 1 in 100,000 chance. So that's really small. But then I would suggest that they're asking the wrong question. And this goes back to what Dr. Higgins was saying. The question isn't whether or not I want to take a 1 in 100,000 chance of having an anaphylactic reaction. Do I want to take the chance of what are my odds if I get infected? So this is what we know if you get infected. If you take the number of positive cases we've had in Harris County and you divide into that the number of hospitalizations, it's 8%. 8% of the people who tested positive wound up in the hospital. Now, you could argue, and you would be right to say, well, that's an overestimate because many other people got infected and they never got tested. That's true. So let's take that 8%. Let's cut it in half to 4%. Tell you what, let's do it one more. Let's cut it in half again down to 2%. Well, 2% is 1 in 50. So 1 in 50% chance of winding up in the hospital versus a 1 in 100,000 chance of having a severe allergic reaction. Let's take it one level further. If I wind up in the hospital, what's my chance of dying? Well, guess what? That's about 12% of the people who wind up hospitalized are dying. And we've had 0 deaths from the anaphylaxis. So I'll tell you what, based on those numbers, I'm taking my chances with the vaccine.
Thank you, Dr. Purse. Darian is asking, if we expect the symptoms, how will those symptoms affect a seizure patient that's taken the vaccine? Can you speak to that?
Well, I would say that I have not heard of seizures being worsened by the vaccine. But of course, if a person is having an issue where they're having brittle seizures, where I say that they're having multiple seizures per day, you want to make sure, you may want to talk to your neurologist before you get the vaccine, because introducing something else to the body could throw things off. But generally, I have not seen that to be an issue. I also saw a question about, I have paralysis on half of my body. Should my daughter get the vaccine on? Should she get it on that side? Now, I would say I don't know, but normally what I would prefer is to get it in the side that I know, where I can recognize if there's a problem. So I would say that more than likely, depending upon her age, realize that 16 is the youngest for the Moderna vaccine and 18 for the Pfizer vaccine. So we would have to question what the age is. I would go with the portion that is well. The reason I say that, now that was my own decision because I had a car accident where a drunk driver hit me coming from the back, and I had an arthritic neck and I had lost control of this arm. All right. So even though I still have problems, I wanted to know myself, I would prefer the good arm to take the shot so that at least I could recognize if something was going on. That would be my preference, but I would say you may want to follow up with your neurologist just to make sure that everything is okay. And more than likely that is a quick phone call or a quick visit to let you know that it's okay. And I would not expect that they would not allow you to get a shot because of the issue of having seizures or an issue of paralysis.
Wonderful. This is, I'm going to say for myself, I've gotten a lot of enlightenment today. I was one of the people who say, I don't know about this vaccine. I'll wait it out. I'll let more people go and get the vaccine and see what the results are before I go. So for people who are still on the fence about it, do you guys have any lasting impressions for them today?
I would just add that to concur with what Dr. Purse and Dr. Higgins has said, that we should fear the virus and not fear the vaccine. That for sure the virus is more detrimental to us individually, collectively, as a community, and as a country. And we just look at the numbers. And so, if you're going to be afraid of something, then be afraid of the virus and not the vaccine, because the vaccine is our method, is our way out of this pandemic.
The only thing I would say, and I'm getting into a little bit into Dr. Higgins' area here, is I would like people to the degree possible, to feel that you do have control over your destiny. We are not the victims of the virus. We as a community, this is Houston. We've dealt with hurricanes, we've dealt with floods, we've dealt with all kinds of adversity as a community, and we've come together and this is another challenge for us as a community, we do have control over our destiny. We can wear the mask. We can social distance. No, we can look out for our family members and make sure they've got food to eat and they've got whatever it is they need if they're staying home. And pretty soon here, we will have plenty of vaccine. We do have control. Let's take control.
And
Dr. Purse, before we go back to Dr. Higgins, Dr. Purse, I see one more question in the comments asking, is one vaccine more effective than the other? And I know you spoke to this earlier, but for those who are just jumping on, is one more effective than the other?
So the numbers are that, and I can't remember which one is which, but one is 95% effective, the other one's 94.5. And the reality is that's within statistical error. So they are essentially equally effective.
Thank you. And Dr. Higgins, going back to you, thank you for that basketball analogy. I'm a basketball fan, so it's stuck in my mind, practicing, getting my body ready and warmed up to play in the real game. So thank you for that. Any lasting impressions for you?
And I'll add one thing, and I appreciate being on with Dr. Purse. I see him on television every day at about 5 or 6 o'clock, and Dr. Blount, a colleague of mine who I've met more than once on several occasions and broke bread with. I hate to introduce something new to you, but I will say this is something that we have to fear in the Black community, is the issue of learned helplessness, and that there's nothing I can do about my circumstances. So therefore, I'm going to ignore that what is going on. And we take that from our history in America, where essentially we're in a situation where we fear, we try, but because of things that are going against us, we can't change our situation. And what I'm saying about this vaccine is that this gives you the ability to fight. So do not be in a helpless situation where you're waiting to get sick, waiting to get ill, and waiting to see if you're going to die. What we're trying to do is say that you can put this in your hands, take the battle to the virus so that your body is prepared and ready to go. You cannot hit the shot with 5 seconds left if you've never shot a basketball before. You have to practice. And we're giving your body that ability to practice, to get ready, to get armed up, to take the fight to the virus. If not, essentially, you're waiting to get sick, and sadly, you're waiting to die.
Wow, great, valuable information today. Thank each of you for joining us on. Ladies and gentlemen, I hope today you got your questions answered, your fears calmed, and that you are ready to make a quality decision for yourself and your communities. Thank you again for joining us on the roundtable discussion presented by Radio 1 and the City of Houston. Gentlemen, thank you again.
Okay, thank you.
Thank you.
Thank you.
Lastly, the website HoustonEmergency.org /COVID-19 is where you can get more information. Thank you all again. Thank you all for watching. And please don't just keep this wealth of knowledge to yourself. What you've learned today, share it with others by word of mouth, by sharing this stream, and definitely by making quality decisions. You guys take care.
Okay, you too.